We are waiting for another senator. In the meantime, I think Senator Cassidy and I had a few questions we'd like to ask. This has been a very interesting hearing, and I think everybody, regardless of where you're coming from, understands that the root cause of the crisis of medical debt is the high cost of health care in America. And the interesting discussion is to why we are spending twice as much per capita on health care as any other nation, and our outcomes are often not as good. I would mention to folks there was a study recently at the Peterson Foundation which talked about administrative costs. Now, I would hope that most of us agree that if we spend $1 on healthcare, we want it to go to a doctor or a nurse or some medicine. We don't want to go to some bureaucrat hounding or some bill collector hounding Ms. Ward or Dr. Chino, who's worried about family members. Not a very good investment in healthcare dollars. Just for the record, in Japan, they spend about $70 a year per person on administrative costs. Sweden, $70, Italy, $74, Australia, $148, France, $306, Switzerland, expensive, $528. The United States, we spend $925 per person, not on doctors, nurses, but on bureaucracy. All right? Brief answer. Now, I'm going to give you my view. You tell me what you think about it. And this really raises an interesting question with Senator Cassidy. We may want to do another hearing, really. I think that the function of a rational, humane healthcare system is to guarantee healthcare to all people, regardless of income, as a human right. I think it's wrong if somebody says to Bill Cassidy here, Bill, sorry, you have cancer. Too bad you're going to die because you can't afford the treatment. I don't think that that's what a civilized society should have. That is what exists right now. Dr. Sayed, now go right down the line to everybody. What should be the function of a sane, humane, cost-effective healthcare system? Doctor?
I'd say it's to prevent the illnesses that can be prevented, treat the illnesses that can be treated, and to prevent the adverse consequences of getting sick in the first place.
Dr. Messak?
To look out for patients. That's the oath I take, and that should be the function of our healthcare system.
Regardless of income?
Amen. Yes, absolutely.
Ms. Ward?
To help all families and children thrive in any way that they can, the best way that they can.
Dr. Chino?
I think our health insurance system, our health care system should invest in the American people, because when you invest in the American people, it will always pay out for you.
Dr. Bai?
I believe we should make all the stakeholders able to benefit themselves. Then eventually that will benefit society as a whole. Everybody wants to be rich. Through competition, then people innovate and eventually drag down price and improve quality, benefiting all Americans.
Dr. Polito?
I think the goal should be to balance cost and the innovation that generates lots of health that we enjoy.
I just read statistics. I think there is no denying, or somebody can deny it if you want, that our system is not only the most expensive, it is the most complicated, the most bureaucratic. Everybody in America spends half their lives filling out forms, arguing with insurance companies, all of which cost an enormous amount of money. Dr. El-Sayed, what is the solution for creating a simple, cost-effective healthcare system?
We've heard a lot about providers and payers, and it's important for us to differentiate between those two. Healthcare providers are the doctors, the hospitals, the folks you see to get care. That should stay private. It encourages competition, and competition is good. But there is no innovation. There is no improvement on the insurance side. This is an industry that sits as a middleman between individuals.
What is the function of the insurance industry?
In theory, they're supposed to protect you from the financial consequences of getting sick.
In
reality, it's to make a lot of money for CEOs of large health insurance corporations.
Dr. Messak?
I agree. We have to cut out the middlemen in healthcare. There's way too much money floating around between patients and the healthcare providers that's never benefiting patients at all.
Why is it, anybody jump in, that we are spending less than half as much per capita on primary health care than virtually every other major country, where I think we all understand the function of a good healthcare system is to keep people healthy? What role do the insurance companies? Do the insurance companies make any money by keeping you healthy? Dr. Chino?
No, sir, they do not.
Dr. El-Sayed?
Yeah, I'll say as a public health official, this is a place of mass frustration because in theory we should, but we've made Medicare the insurer of last resort rather than the insurer that should cover you your whole life. And so what happens is any investment that they make in prevention early on is going to redound to Medicare's benefit. So there's really no incentive for them to invest up front in keeping you healthy, but rather we have a situation where they're being subsidized over the long term, and so that prevention is not happening.